Case 6, 2016, a 10-year-old boy with abdominal cramps and fever. Definitions. The term stomach cramps is non-specific and is used to refer to a number of different symptoms or sensations, rather than true muscle cramps of the stomach. People often refer to a stomachache or abdominal cramps to refer to pain that is perceived anywhere in the abdominal area. As such, the list of potential causes is extremely varied. Organs of the abdomen include the stomach, small intestine, colon, liver, gallbladder, and pancreas, and problems or diseases of all of these organs may be the source of pain. The fever, therefore, is the increase in body temperature above normal, which is accompanied by an increase in heart rate and respiratory, and manifests the body's reaction to any disease.
Alright, so stomach cramps are basically cramping of the stomach or cramping of the digestive tract. And basically what that is acute muscle contractions. Because remember, the digestive tract is one long muscular tube. So anytime you have abnormal contractions, you can develop a cramp, just like you get a cramp in your leg. So basically what's happening is there's some altercation within the motion of your digestive tract that causes an abnormal contraction of that portion of the digestive tract. So that pain, what you're feeling, is basically an abnormal muscle contraction. And that can be related to an illness, or it can be related to constipation or diarrhea, or some sort of abnormality in the motion of your digestive tract.
Applications in medicine. A 10-year-old boy was seen in the gastroenterology clinic of Massachusetts Hospital because of intermittent abdominal cramping and fevers. The patient had been well until approximately 3 weeks before this presentation, when intermittent fevers to a temperature of 39.7 degrees Celsius occur, followed by episodes of cramping in the preumbilical and subumbilical abdominal regions, without vomiting. Computed tomography of the abdomen and pelvis performed after the administration of contrast material revealed circumferential moderate thickening of a long segment of the colonic wall at the hepatic flexure and adjacent mesenteric lymphadenopathy. The gastroenterology clinic reportedly he had intermittent, mild, self-resolving abdominal pain throughout childhood that was associated with diarrhea and was thought to be caused by lactose intolerance. His immunizations were current. He took no medications and had no known allergies.
So if you have abdominal pain, trying to treat it and trying to prevent it are very difficult questions to ask. So it's important to understand where the pain's coming from in order to treat it, in order to prevent it. So if you're having pain, say in the right upper quadrant that may be going up to your shoulder and it's more of a cramping pain, that could be gallbladder disease or gallstone or something of that region. It'd be important to see your doctor because they may order some tests to take a look at your gallbladder to see if the gallbladder is inflamed or if there's a stone that's stuck in the duct or some sort of abnormality there. If you're having epigastric pain and that's associated with heartburn or pain after eating, You may have gastritis or a peptic ulcer or something of that region, and the doctor may ask you to see a gastroenterologist to do an endoscopy to take a look inside your stomach to see if you have an ulcer. If you have right lower quadrant pain, the most common cause of pain in that area is appendicitis. So you may have to go to the doctor to have that evaluated to make sure you don't have appendicitis. If you do, that's considered a medical and surgical emergency. Your doctor may order a CAT scan in order to take a look at that region of your digestive tract and order the appropriate tests. And if surgery is required for the appendix, he'll call a surgeon to do an appendectomy. Again, if you have pain on the left lower quadrant, again, diverticular pain or diverticulitis is probably one of the most common causes of pain in that region. Again, the doctor may order some tests or a CT scan in order to investigate that. Now, based on their investigation and the tests that they order, they'll recommend different therapies, and depending on the cause, they're going to have special medications such as antibiotics, or if it's a surgical abdomen, you'll have to be referred to a surgeon to have surgery done. So it's a very difficult question to ask, but understanding where the pain is coming from helps to manage it.
Pros and cons. Pros. The advantage we can take is that as much as abdominal cramps and fever are a kind of alert to know if you are going to present or if you already have a disease, and so can take preventive measures. Cons. Abdominal cramps can be symptoms of different diseases such as acute gastritis, period pains, aortic dysfunction, inflammation of the spleen, vesicular stones, excess gas at the abdominal level, appendicitis, viral gastroenteritis, among others. You have to avoid stress because this can carry out several episodes of abdominal cramps a day. For this reason, it is better to handle calmly and good mood.
If you experience painful abdominal cramps, you'll know there can be different triggers. Stress, food that doesn't agree with you, or simply overdoing it. But wait, did you know you can target the cause of your pain? Abdominal cramps occur when your intestinal muscles spasm. Rather than a painkiller, why not try a treatment that targets the spasm? Buscopan Cramps works directly in the abdomen to relax the muscle spasms and ease pain and discomfort. It also starts to work in just 15 minutes. So ask your pharmacist for Buscopan Cramps. Relieve the cramp, relieve the pain.
Issue applying in Ecuador. In Ecuador, people do not have the habit of exercising. nor of having an adequate diet, since the food in this country often has many condiments, although it is delicious, but this can harm health. For this reason, we must change our lifestyle to be able to counteract these problems, like abdominal cramps that later turns into gastritis. Conclusion. In conclusion, the various diseases that can occur in a child I have seen in this case that is detectable at time to be able to act must be treated in a more specific way that can be a child and can always be linked to many more causes. For these signs and symptoms are important to take previous actions.